Hi, I'm Phil Gowers, Chair of Hampshire and Isle LDC, presenting the first motion to the LDC Conference. During these unprecedented times of COVID-19 pandemic, the supply chains broke down. We were left with inadequate PPE throughout the UK. The dental teams banded together to share what scant resources we had to quickly and brilliantly set to the new normal. We all worked together for the common good, looking after patients and ourselves. As a member of the PPE steering group for South East England NHS, I saw firsthand how supplies of appropriate PPE were erratic, inadequate, and costs soared. We are now in the new normal, and I implore conference to support this motion. So NHSE and NHSI learn from these events, so we don't fall into this debacle of scarce PPE provision again.
All right, thank you. So that was Phil. And if anybody would like to speak to this motion, could you raise your hand now? Don't appear to have anybody wanting to speak that. So we can actually, in that case, go straight to the first vote on this. And we're voting on the substance of the long form of the motion that was with Phil there. There's going to be a précis in the vote, and you will also see on that who has permission to vote. So do remember to press submit after you voted. Binal, what's happening? Are we getting our results through? Here we go. Oh, right, okay. So that has that motion has been carried quite decisively. Next up, we're going to go to motion 2, and we're going to hear next from Martin Longbottom, who's got 2 motions that sound similar, but there is an important distinction between the two of them. So pay attention to that, please. So motion 2 first.
This conference asked that all necessary PPE, including any fit testing necessary, be provided free of charge for NHS use at all registered dental sites. Good morning, conference. Despite it being announced that £15 billion has been spent on the PPE by the Treasury, for dentistry there's been little help with PPE provision and insufficient notice to obtain PPE in our return to practice. The government has spent £10 billion on its bungled test and trace system. Couldn't dentistry have had a little of this wasted money? Previous governments made the decision, rather than stockpile supplies for a pandemic that several scientists predicted would occur, they would rely on a supply chain to provide the items as required. Unfortunately, the nature of a pandemic means that the whole world required PPE at the same time. This has caused a massive increase in PPE costs. Gloves, masks, gowns, aprons and visors have at least tripled in price. Our area team have already issued an email to all practices stating that NHS patients cannot be charged additional fees to cover the cost of PPE, even quoting the GDS contract, section 15, clause 242. Fit testing has been uncoordinated, with practices having to make their own provision at their own costs, with only UDCs receiving NHS help. The NHS should have provided fit testing and PPE free of charge for the commencement of dentistry. Please support this motion.
Well, thank you there, Martin. It looks as though we have 2 people who would like to speak to this motion. First up, we have Brian Robertson from Norfolk. So, Brian, could you turn on your camera and unmute yourself? And what would you like to say?
Oh, I'm very sorry. I don't quite know why that happened. I didn't actually have anything to add to that. I do apologise.
Okay, all right. Well, then in that case, we'll go to Marion English, please. Marion.
Hello, can you hear me?
Yes,
yes.
Loud and clear.
I would like to support this motion, but I feel that consideration needs to be given to proper funding. I was trained as a fit tester by NHS East of England, and since the 3rd of June, my colleague and I, Jonathan Randall, we've done 500 tests and we visited 53 practices. Unfortunately, I was not supplied with the appropriate kit by NHS England. We had to source that ourselves. I had to spend quite a lot of my own money on the chemicals. We don't get any travel expenses, and some of the practices are 160-mile round trips. My colleague, Jonathan Randall, has had to pay for his own indemnity. My indemnifier covered me for it. And after a month, we were given a memorandum of understanding, which signs you up for the whole year, doing all of this at your own expense. And the training certificate has been withheld, and they haven't addressed the GDPR issues. And I would suggest that the motion could be reinforced, perhaps, with appropriate funding needs to be necessary as well.
Okay, well, thank you for that, Marion. And I think Ian Gordon from North Yorkshire would like to comment as well. So Ian, mic and camera on, please.
Yeah. Morning, conference. I can support some of the motion in terms of the fit testing, that hasn't been ideal and perhaps should be funded and indemnity provided as Crown indemnity. But I would say caution about the relying on NHS England to supply. Be careful what you wish for. If the funding comes through the lack of contract value abatement, such as we've actually seen in the final analysis, then we're responsible for sourcing our own PPE. Had we been reliant on NHS England to provide it, then we're reliant on their supply lines, and we'd end up having to buy our own but not have the funding in the funding mechanism. So I can't support the motion.
Okie dokie, so we have 1 for and 1 against there, and I think that's all the speakers for this. So at this stage, could we launch the vote for motion 2? There you go. So this is it's a UK motion, so everybody can vote, all LDC representatives and agenda committee. And don't forget to press submit, please. And as soon as everybody's voted, we'll get the results. Okay, we should be getting a result fairly shortly, and let's see what it is. And again, that motion has been carried.
This conference asks that all necessary PPE, including any fit testing necessary, be provided free of charge at all registered private dental practices. Due to guidelines, dental practices face a reduction in the number of patients that can be seen, and at least a threefold increase in PPE costs. This will increase the financial burden on practices that have already been pushed close to the financial abyss. Patients will have to pay more towards the cost of their dental treatment, otherwise practices could face bankruptcy. Denplan has allocated £2 million towards PPE costs for Denplan practices. After £10 billion spent on the government's test and trace system, the government could fund PPE for private dental practices. Please support this motion. Thank you, conference.
Okay, so this is motion 3. Oh, we have Nick Stoles from Norfolk who would like to speak to this. So Nick, is your mic and camera on, please?
Yeah, thank you, Leah, and congratulations on chairing this conference. I have a problem with this motion, and I'm slightly mystified as how it's appeared on conference papers. We're here at the annual conference of LDCs to represent the interests and views of our constituents, who are predominantly GDS contractors. Granted, PDS can opt in, and a handful of private dentists pay the levy, but we're principally NHS contractors. A motion that refers only to the private sector will be divisive. If we vote in favour, and that suggests perhaps that all sectors of our profession can expect motions to be debated at LDC conference. If we vote against it, it sends completely the wrong message to those colleagues who have borne the greatest financial hardship of all of us during this pandemic to date. Private dentistry is finding its representational feet, and it's also it's got its own professional organisation to help lobby. There is a private dentist subcommittee of the GDPC and many private dentists on GDPC itself. In my opinion, that's the route for this initiative to be taken, not here at LDC conference. I would ask that this motion be withdrawn, and if that's not forthcoming, then I'd ask you to abstain when voting to avoid sending the wrong message.
Oh, well, thank you for that, Nick. And if we, I think, I think we're going to go to the vote on this actually. So there was a distinction. We're going to put it up as motion 3. And could you either, well, you've heard Nick, decide what you want to do on this vote. And don't forget to press your submit button. This was originally a joint motion for NHS and private sites, but I thought that would be confusing. And so the motion was divided into 2 for that reason. And we should have the, oh, okay. So that is an abstention in line with what Nick asked for there. So that's that. We'll close that